This video we will see the interior of the skull. It will include the interior of the skull cap as well as the interior of the base of the skull. Here I will show you the important landmarks and the foramina. The contents or the structures passing through the foramina you have to remember for your viva. Let us see the interior of the skull cap. It shows three bones, anteriorly the frontal, parietal and posteriorly the squamous part of the occipital bone. There are few vascular markings of the middle meningeal artery. There are depressions or pits called the granular foveoli for the arachnoid granulations, and in the midline is the sagittal suture. If we see the interior of skull, we can see three levels. The anterior cranial fossa, which is at a higher level. Then there is the middle cranial fossa, which is one step lower, and the posterior cranial fossa, which is the lowermost. Here in this figure you can see different colors. The blue one is anterior, middle brown one, and the posterior is the purple colored. Let us see the bones forming the three cranial fossae. The first, that is the green color, which is shown here by the number 1, is the frontal bone. These are the orbital plates of the frontal bones. Second one is the cribriform plate of the ethmoid. So second bone is ethmoid. Third is the sphenoid, the lesser wing part of the sphenoid, here seen as the red color. The fourth bone is the temporal bone, which is seen here. The fifth one is the parietal bone, the light colored, the parietal bone, and the sixth one posteriorly is the occipital bone. 6 bones which are seen from before backwards, forming the interior of the skull. Let us see the anterior cranial fossa, which shows the frontal crest, the sharp line, the cribriform plate of the ethmoid, which is a sieve-like, crista galli in the middle. Where the frontal crest meets the crista galli, there is an opening called foramen cecum. This is the this is the lesser wing of sphenoid. The two lesser wings meet here, that is called jugum sphenoidale. The sharp margin is of the lesser wing of sphenoid. It ends by two roots. The anterior root goes here and forms the jugum sphenoidale. Between the two roots is the optic canal, and here this lesser wing ends in a anterior clinoid process. So these are the features of the anterior cranial fossa. You must know structures passing through the cribriform plate, through the foramen cecum, and there are two more foramina, anterior and posterior ethmoidal foramina. This is the middle cranial fossa. Its boundaries are anteriorly the lesser wing of sphenoid and posteriorly the superior border of petrous temporal bone. Now from before backwards, in the middle part it shows the sulcus chiasmaticus. Behind that there is a groove called the optic chiasma, then a raised area, that is tuberculum celli, the center part, which is the hypophyseal fossa, and behind it another raised area, that is dorsum celli. The tuberculum celli on its either side shows two elevations which are called the middle clinoid process, and the dorsum celli on either side show the posterior clinoid processes. In the middle cranial fossa, you can see between the lesser wing and the greater wing of sphenoid is the superior orbital fissure. Then a circular foramen, which is the foramen rotundum. Remember, this is not seen on the base of the skull because it opens in the pterygopalatine fossa. Behind it is a oval foramen ovale, and behind that foramen spinosum. So in sequence there are three foramina: foramen rotundum, ovale and spinosum. There may be sometimes a small foramen between ovale and spinosum, that is called the foramen of Vesalius. So in the middle cranial fossa, from before backwards, there is the optic canal, then a circular foramen rotundum, foramen ovale, this is the foramen spinosum. At the apex of the petrous temporal bone, there is foramen lacerum. A trigeminal cave is present along the anterior surface of the petrous temporal bone, which lodges the trigeminal ganglion, and a carotid groove for the internal carotid artery by the side of the body of sphenoid, where it is related to the cavernous sinus. Let us see the posterior cranial fossa, which shows the dorsum celli. The clevus is a sloping surface formed by the fusion of the basi occiput with the basi sphenoid. The foramen magnum, which is a large foramen in the midline. Internal occipital crest, which ends as the protuberance. Then from the lateral side of the internal occipital protuberance, there are the transverse sinus, groove for the transverse sinus on either side, which continue as the S-shaped groove for the sigmoid sinuses. This is an enlarged picture to show the lateral side of the posterior cranial fossa, which shows three foramina from above downwards. The first one is internal acoustic meatus, which lies along the posterior surface of the petrous temporal bone and through which traverse the 7th and 8th cranial nerves. Just below that is the jugular foramen, through which pass the 9th, 10th and 11th cranial nerves. Just below that is the hypoglossal canal, through which passes the 12th cranial nerve.